in.
Hi, I'm Emily and I'm going to be your nurse today. So I'm going to start by gathering my supplies. Pen light, here, my stethoscope, and my gloves, which I'm going to leave here for now. And then I'm going to perform infection control, so alcohol swab, clean my stethoscope, and clean my hands. All right. So do you use any assistive devices?
No.
All right. And then throughout this assessment, if you experience any pain or discomfort, just let me know, okay? So I'm going to start by asking you a couple questions. If you could tell me your name, where you are, and what day it is.
My name is Sally Jones. It is Friday, and I am in Old Orchard Beach.
Okay. So patient is alert and oriented ×3. Speech is clear, no slurring. Level of consciousness is alert, so appropriate. And patient is able to respond to questions. So I'm going to give you 3 words that I'm going to ask you to recall later. So if you can remember sunshine, tooth, and earring. Right.
Okay.
So I'm going to have you smile, frown, puff your cheeks, and raise your eyebrows. Okay. So patient's cranial nerves are intact, no facial abnormalities, and they're able to respond to command. And then I'm going to have you close your eyes, and I'm going to touch a point on your body and just tell me where that is.
Right arm, left leg, left cheek, right foot, left hand.
Okay, so patient's sensation is intact. And then I'm going to start with your head. So by inspecting the head, I can see that it is in appropriate placement on the body, appropriate size and shape, no visual abnormalities. And then in order to palpate the scalp, I need to apply gloves. I'm just going to palpate, so I'm just going to feel. And I'm just going to look. Okay, so no palpable masses were noted, no visual lesions, there were no critters, visible. And the hair was evenly distributed, of good texture and color on the head, so all of that is normal. And then I'm going to remove my gloves and again perform hand hygiene. And then I'm going to start by assessing your eyes. So if you can just look at me. All right, so pupil is 4 millimeters. Eyes are symmetrical, appropriately placed on the face. Size and shape is appropriate. There's no droop or drainage noted. The sclera is white, which would indicate no jaundice. Conjunctiva is clear. Pupil is round and green. Not pupil. Iris is round and green. And then no edema of the eyelids. And the hair of the eyelashes and eyebrows are appropriate. So then I'm just going to check your conjunctiva. So I'm just going to pull down and look. All right, and both of those look good. Conjunctiva is pink. No discharge is noted in that area. And then, do you have any trouble with your vision?
No.
Okay, so no problems with vision noted or reported. And then I'm going to have you do the peripheral finger test. So just let me know when you can see my finger. Okay. So patient's peripheral vision is intact. And then I'm going to have you follow my finger. So 6 fields, cardinal fields of gaze. Test was passed. The nerves are intact, no nystagmus or any problems with the eyes. And then I'm going to look at your pupils with my pen light. Both sides. Okay. So equal, round, reactive to light, and constrict consensually bilaterally. And then I'm going to test for accommodation, so if you can follow this pen towards your nose. Back out. Okay, so both the left and the right eye were bilaterally consensual, or bilateral accommodation, so accommodated appropriately. And then I'm going to inspect your mouth. So by visually inspecting, I can see that the lips are pink and moist. Mouth is appropriate size, shape, appropriately placed on the face. And then I'm going to have you say ah, and I'm going to look into your mouth. Alright, so I can see that the uvula is midline, mucosal membranes are pink and hydrated, tonsils are intact, there's no sign of cyanosis around the mouth or in the mouth, so no problems with oxygenation. Then I'm going to have you show me your teeth, and if you can open. Alright, so teeth look healthy, no dental caries, no plaques noted on the teeth. And then I'm going to have you stick out your tongue for me. Okay, so tongue is pink, good size and shape, no odor. Are you having any problem with taste with that?
No.
Okay, so no problem with taste. Reported by the patient for problems with the tongue. And then I'm going to inspect the nose. So by visualizing the nose, I can see that it is appropriate size and shape, appropriate placement. No visual abnormalities, so I can't see any rashes or drainage lesions, anything like that. Are you having any difficulty with smelling?
No.
Okay, so patient reports no difficulty smelling, and then I'm going to look with my pen. So no deviated septum or other discharge or drainage noted. Are you have you close one nostril, block one nostril, and then breathe in, and then same thing with the other. Alright, so nostrils are patent bilaterally in the patient. And then lastly, for head, I'm going to do your ears. So I'm going to inspect ears behind them. Okay, so appropriate size, shape, symmetrical, appropriate placement on the body. No deviation in that, no visual rashes or abnormalities, lesions behind the ears or anything of that sort. And then I'm going to palpate them, so I'll just feel no palpable nodules. And I'm going to look for drainage, which I don't see, so you're all set with that, so no abnormal drainage. And then I'm going to perform the whisper test. So I'm going to have whisper a word on each side in your ear and just tell me what that word is.
Rainbow. Thunder.
Okay, so patient passed the whisper test, which would indicate no hearing difficulties. And then after I am done with the head, I will move on to the neck. So I'm going to inspect the neck. By visually looking at it, I can see that it is erect, midline on the body, so appropriate placement, appropriate size and shape, no abnormal bulges or anything like that, no deviation. The trachea appears to be midline, and I'll have you swallow. So swallowing is intact, no palpable thyroid, which would indicate no presence of a goiter. And then I'll have you, actually I'll palpate, let me know if you have any pain or pressure, and I'll palpate the sinuses. And so no pressure or pain in the sinuses reported. And then I'll do your lymph nodes. Okay. No pain?
No.
Okay. So no pain or hardening of the lymph nodes, no abnormalities, and they're not palpable, so no sign of infection is noted with the lymph nodes. And then going to have you raise your shoulders. Okay, so spinal accessory nerves are intact. Patient is able to raise shoulders. And then lastly, with your face, I'm going to have you just open your mouth so I can assess for TMJ. Okay, so no crepitus, which would indicate no presence of TMJ. And then I'm going to have you do range of motion with your neck. So chin down to the chest, back, and then side to side, ear to shoulder. Okay. No pain?
No.
Okay. So patient reports no pain with range of motion of the neck. Range of motion is good, able to be performed. And I'm going to move on to the pericardium. So I'm going to palpate the pericardium, so over the heart. Any tenderness or pain?
No.
Okay. So no abnormalities with pericardium. No flutter was noted, able to be felt. No masses, protrusions, or anything like that. Patient didn't appear to have any difficulty with breathing or having to heave in order to get air. And then I'm going to listen to the heart. So I'm going to do both diaphragm and bell. Diaphragm first. Diaphragm first. And then to the apex. And then switch over to the bell. So no abnormal rate or rhythms noted with the heart. No abnormalities. Rate or rhythm. No whooshing sounds are able to be heard. S1 and S2 are both present, which would indicate mitral and tricuspid valves are functioning properly. And then I'm gonna do your carotid pulse as well. So I'm just gonna feel first. Okay, carotid pulses are equal bilaterally, and then I'm going to listen to them. So no normal rate or rhythm noted with the carotid. The pulses were 2+ strength bilaterally. No growths were able to be heard on auscultation. And then I'm gonna next do your lungs. So I'm first have you stand up. So I can feel for lung expansion. I'm gonna have you take a deep breath. Okay, yeah, you can sit there. So lung expansion was appropriate. No difficulty with inspiring air. Both lungs inflated bilaterally. Normal expansion. No visible barreling of the chest is noted in inspection, and then I'm going to listen for lung sounds. I'm going to have you take a deep breath. On the other side. And then just a couple on the back. Okay. So, patient's lung sounds were of normal sound. Sounds were present, equal bilaterally. No crackles, wheezing, or bronchi was able to be heard, so that indicates normal lung sounds. And then I'm going to have you hold out your hands for me, and I'm going to do your skin trigger. So adequate hydration is noted because no visible tenting of the skin, and then I'm going to have you hold out your hands for me. No clubbing is visual in the fingernails. Capillary refill is under 2 seconds in the nail bed, so that indicates adequate blood flow and no cyanosis, so adequate oxygenation. And then I'm going to do your radial pulses. Always have your toes. So radial pulses, normal rate and rhythm, equal bilaterally, and 2+ in strength. So then I'm going to have you repeat back the 3 words that I had you remember at the beginning.
Sunshine, tooth, earring.
Okay, so patient is able to successfully recall the 3 words, which would indicate that they have their short memory is intact. And then I'm going to assess your gait. So I'm going to have you get up and walk to the end of the room and then walk back. So you can just stand. So patient has no abnormalities with their gait, no limping, no swaying, no problems walking. And so then I'm going to have you balance on one foot and then same with the other foot. So the balance are coordination problems, and then I'm going to have you close your eyes and hold your arms out to the sides. Okay, you can open. So patient, again, no problems with balance. Pass the Romberg test. And then I'm going to have you turn around and dive down, and I'm going to assess your spine. Okay. So no palpable masses, no lesions on the spine, no curvatures, which would indicate no scoliosis, kyphosis, or lordosis. Skin is appropriate color, warm, dry, and again, no rash. So then I'm going to have you bring your heel up your shin, both legs, and then hands on knees, and just switch like this. Okay. So patient's gross motor skills are intact, and then I'm going to have you do finger to thumb. Okay. So patient's fine motor skills are also intact. Then I'm going to have you do range of motion in your extremities. So we'll start with the legs. If you could just swing your leg forward and back. And then bend your knee. Okay, so no crepitus out on that side, and then same thing. Okay, so no crepitus. Patient is able to perform range of motion adequately. And then we're going to do the same thing with the upper extremities. So you can do a circle with your arm for me. Okay, and then bend your elbow. And turn your wrist and squeeze. Okay, we're going to do the same thing on this side. So big circle, elbow, and then turn and then squeeze. Okay, so range of motion with the upper extremities was also intact, able to perform rotation with no difficulty. They have no signs of crepitus in either the upper or the lower, so that indicates no crepitus, no problems with the joints. And you can sit back down. So range of motion is appropriate, so now we're going to just test the strength of all the same kind of places. So I'm going to push down, you could just push up, and then push down when I push up and down. Okay. So strength of the legs or lower extremities is a 5 out of 5 bilaterally, and then you're going to do up with the arm, down with the arm, oops, sorry, up with the arm, down with the arm, and then squeeze my hands for grip. So upper extremity strength is also as well 5 out of 5 bilaterally, so appropriate strength. And then I'm going to assess the feet and lower legs, so if you can lay down. And I'll start by having you move your ankles in a circle. This one. Okay. No signs of crepitus, and patient's able to perform range of motion with the ankle, and then spread your toes. As well, no signs of crepitus. I will assess the skin turgor of the feet. So make sure that there's adequate hydration. Yep, everything looks good. No tenting visible, and then I'll assess the nails, which all are intact. capillary refill under 2 seconds, so that's appropriate. And overall skin of the lower extremities appears warm, dry, it's pink, and there's no visual abnormalities, no bruises or lesions or any bumps or anything. And then I'm going to do the pulses of the feet as well. So dorsal pedis pulse and posterior tibialis. So pulses are equal bilaterally in both of the feet. 2 plus in strength, and so next I'm going to assess the abdomen, so we can bring your knees up for me, and I'm going to start by listening to your bowel sounds. So inspecting the area, the skin is of appropriate color, pink, dry, warm to the touch, no visual abnormalities. I'll listen to all 4 quadrants, and then as well do the vascular sounds. So bowel sounds are present in all 4 quadrants. No, they weren't hyper or hypoactive, just normal. And I assessed the vascular sounds to make sure that there was no indication of aortic aneurysm. And then I'm going to palpate. So again, on your abdomen, let me know if you feel any pain.
No pain.
Okay, so patient reports no pain upon palpation. The palpated masses, no visual lesions, and you can sit up. And